From here on, Prime Minister will make his statement at this press conference. First, Prime Minister will make his statement. Prime Minister, please. The COVID-19 task force was just opened, and for the 19 prefectures, state of emergency declaration and the 8 prefectures quasi-emergency declaration will be all lifted at the expiry date of September 30th. And we will be step by step gradually easing the limitation that was already approved. Ever since July, the strong infectious disease, the Delta variant, has been rampant around Japan with unprecedented speed. It was spread all around the nation, and along with that, the number of beds were strained. It was an extremely tight situation. With that condition, the medical services providers and restaurant bar organizers and civilians, the citizens of Japan, every one of the people in this country has been cooperating for the creation of the medical system and to prevent infection and go through the vaccination. Every one of the people have been working with great effort in order to subside the infection. Many people have been putting much effort, and around mid-August, 25,000 new infection case or over has been declined dramatically. And yesterday, the tally counted 1,029 patients in Tokyo, starting from 5,773 people, has been declined to 248 people. The usage of the bed for all the prefectures in Japan, the bed usage rate has been under 50%, and for seriously ill, the peak was peaked out in September, the early phase of September, and now it has phased out. It used to be that people having some quarantine at home and recuperating was 130,000 people, but now it is on the decline. Currently, the condition of today, as the expert has been indicating our way the other day, the criteria for lifting the emergency is now met as of today. Therefore, the government has been deciding on to lift the state of the emergency and the quasi-emergency declaration. For all the citizens who have cooperated until today, I would like to send my heartfelt gratitude. Upon my gratitude, we have to maintain our high vigilance on the virus. And for the limitations for restaurants and bars, we will be deregulating and easing level by level on the limits that have been put on them. The battle against the COVID-19 is now entering into a new phase. The vaccination is now rolling out in great speed. The infection risk has been high in some point, but we were able to control that. And with that, the number of infection is dropping significantly. The vaccination and the neutralizing treatment is now preventing people from getting ill severely. As shared at the panel, the death ratio for the cumulative 6 through January to March, it was 2.4%. And from April to June, it was 1.7%. And for this term, meaning July to September, it came down to 0.3%. So with such significant changes, the building of the medical system has been making this a reality. Therefore, even if we have some infections, we were able to provide stable medical services to the citizens. From here on, we will be working on the assumption of the virus itself and raising the capability of the society itself in order to cater to the virus. And infection prevention and daily lives are going to be juggled together hand in hand to that. We would like to work on 3 policies.
First, on medical structure, we need to further bolster it. From April, nationwide, 4,800 as well as 14,000 hotels and 4,800 hospital rooms, as well as oxygen stations. And in fact, altogether, we have 80 facilities that we are still raising the number of at this moment. For those recuperating at home, clinics nearby, as well as experts and doctors who visit homes have made observations and have made judgments of whether hospitalization is necessary, and in various areas have developed a medical structure that would accommodate those patients. And the team that I have met of home care medical services, in fact, the team members take turns in visiting the patients. They use cloud hunting as well as funding from corporations to dedicate their services to the patients, as well as we see outstanding effects as from the neutralization antibodies. In fact, we already have them for 34,000 people who have been administered with it. Therefore, you don't have to be hospitalized, but in fact, by virtual medicine checkups, as well as by doctors visiting your home, you could be administered with them. And with this super drug that is now available, that is in fact innovative. We have also, I have been also informed that doctors themselves have been amazed by it. By fully utilizing these resources that we have structured or organized going forward, even if we see a surge in cases going forward, we need to bolster a organization and structure that fully accommodates and responds to it. Each prefecture, as well as medical institutions, will collaborate, and in fact, the hospitals, rooms that could be utilized immediately, as well as the facilities that could be brought in, need to be actually attained, and we will further make progress on that. And also avoiding the 3 C's, which is the basic preventive measures to be firmly in place, and to avoid on part of the citizens any activity that goes counter to that would also be asked. And in fact, from yesterday, we have a kit that prevents infections that could be brought at pharmacists' drugstores. And in fact, if you do not feel well, you can use that kit to actually, if necessary, visit your doctor. And second, steady vaccinations will be continued this month. Vaccinations 1.1 million per day has been advancing. In fact, 160 million altogether vaccinations have been administered, and 69% have been vaccinated once, and 58% have been fully vaccinated. And in fact, several days back, we have surpassed the vaccination rate of the United States that we were far behind. 90% of seniors have been vaccinated, and a large number of people have been vaccinated. With the effect of these vaccinations, at this surge, or this phase of a surge, 90,000 of above 65, as well as the the death toll has been reduced by 8,000, which is a estimate that the Ministry of Health, Labor and Welfare has published. In fact, we see vaccinations for those in their 50s and 80%, and 60% have received, in fact, full vaccinations, which has made major contributions to suppressing the case count. And from October to November, at an earliest point possible, to all those who wish to be vaccinated, we will further vaccinate to complete full vaccination of those who wish to be vaccinated. And many municipalities have raised their vaccination rates to 80%. And if we advance on this pathway, we would be amongst the most vaccinated countries in the whole of the world. All of you rendering your support in this process, in fact, I'm very proud of it, as well as, in fact, filled with appreciation. And the third booster shots are already in view. We have already contracted 200 million doses. If 8 months or more has passed since your second dose, we will actually, based on the Deliberation Council's views, we will further progress our preparations to start administering the third booster shots within this calendar year. And third is to restore daily life. By vaccination, the society as a whole has enhanced its protection to cases, and we see substantial drop in case counts. And at last, we see restoring our public lives to a safe and secure public life. And we will phase the easing from October the 1st. For the time being, we will have partitions as well as ventilation in place. And those who eateries have been certified, the prefectures will give their judgments to actually start offering alcohol, and will be open until 9 in the evening. And for events, the utmost number of the capacity would be 10,000. And we will also utilize further measures that, in fact, include certificates as well as tests. And also the international travel, we will proactively consider the easing of restrictions from the 1st of October. Basically, those who have been vaccinated, in fact, we will shorten the period of self-isolation at home from 14 days to 10 days, in principle. And we will take further measures that will be studied ongoing.
So after I became a prime minister, it is now 1 year past. And with the battle of COVID-19, I was flooded with the battle against the COVID-19. And ever since I became a politician, I have been listening to many range of people, so that within the society, people can live lively and vividly. And that has been my political career. Those people recuperating at home, and for the livelihood of the restaurant owners and operators, and the education of children, and those in needy in life, and those who are suffering in isolation. For those people, I have been always thinking about them, and I have been reviewing what I should do and made some reflection. And I came to this point that I should work on vaccination and the treatment. I thought maybe it was impossible, but then I was not confined to my normal thinking. So if I needed help, I wanted and reached out for paramedics, and I reached out for clinical professionals. in order to shoot the vaccines when the people who can shoot the vaccine were lacking. And by doing so, I was ensuring those people who can vaccinate to the citizens. And within the Ministry of Health, the countermeasures was not only done by the Ministry of Health. I was asking for all-out cooperation for every organizations, every people, organizations within the society, including the local government. And as a result of that, the vaccination is now reaching all around the nation. And with the treatment, the medical treatment and vaccination is now becoming available. Now we see a clear path and a brightness shown at the end of the tunnel. I have already said that, and when I said about this light being able to see at the exit, I was criticized, but now the effect is much more clear, and the light is becoming brighter every day. The lighter symptom people, the patients that have lighter symptoms, the oral medicine is now under development. And right now, after the approval, in order for these people to be administered to this oral medicine, I am now on the way to work for all the citizens who have cooperated with me. I once again would like to send my heartfelt gratitude. Again, thank you very much indeed. So last year, I became a prime minister. And 1 year has passed during my tenure, and I've been running, and have been busying myself. And it was such a short tenure to do everything that I wanted to do. However, I challenged myself, and I was able to draw a pathway to and way that I would like to work on. On April, I met President Biden, and I have been directly asking President Biden to start opening up for the imports from Fukushima produce, and as a result, the America has been decreasing or eliminating that ban on the import from the product of Fukushima. And I think it is going to be a restoration and contribution to encourage the people of Fukushima. So I was able to show this encouragement, and it is the strong U.S. alliance, Japan-U.S. alliance, and U.S. security alliance is at its heights. And the other day, the Japan-U.S. Leadership Summit has been realized, and we also had a Quad. And at that time, the FOIP has been promoted very strongly, the free and open Indo-Pacific. Right now, we are at a critical path for Japan. So this is a difficult time where the country is suffering the depopulation. The number of children is on the decline, and the aging society. And there is the digitalization, which has to be done. And for the future of Japan, in order to realize growth, we have to create a new society. And even though if it is having a pain for restoring this country, all these challenges are becoming much more important for us to tackle.
Last but not the least, for the last year, thank you very much. For the reporters, I would like to thank them for covering me. And to all these members of the public, without your cooperation, we couldn't have achieved anything. As a cabinet to work for the people, I would like to express my sincere gratitude and appreciation to all the members of the public, including the reporters. Thank you. Now, we'd like to take questions from the reporters, and we also have Dr. Omi to also accompany the Prime Minister, depending on the substance of the question. Those who have been asked to ask the question, please advance to the microphone. First, from Nippon TV or NTV, which is one of the coordinators. Please ask your question. I'm Yamazaki from NTV. you have mentioned earlier, going forward, you will bolster further the medical service provisioning structure, and in doing so, prefectures will coordinate. And you have mentioned that you will advance preparing a draft plan to secure the number of hospital beds and rooms. And this was, in fact, a difficult point that, in fact, you could not achieve, as in the previous press conference. You said that this is one reflection point. Can you tell us why you couldn't secure the number of hospital beds and rooms, and also how candidly you feel about it in advancing the plan that is now being drafted? And when the next cabinet comes in place, what first needs to be addressed to counter the sixth wave this winter and autumn? First, the spread of cases, in fact, far outpaced the number of beds that have been secured at hospitals. COVID-19 treatment, more than any other treatment, is consuming hospital medical resources, and we see a shortage of medical doctors as well as nurses. However, since this year, we have added hospital beds of 13,000, and in fact hotel rooms of 26,000. And by revising, in fact, the infection law, we have also asked for cooperation further. The infection disease law, that is, has been revised. However, securing resources in fact, do not come overnight unless you persistently pursue it. Though you may have a large pool of nurses, there are a small number of nurses who would cope with COVID-19, which are amongst the various reasons. Therefore, we need to constantly, between prefectures as well as hospitals, on part of the government, we need to support the coordination among the two, which I believe is necessary. Therefore, for myself, as I've mentioned earlier or previously, it's not just to have beds accommodating, but in fact, the struggle was actually, as many people have raised, was the stumbling block. And including that, we need to cope with the situation of the sixth wave. We are better protected because we've been vaccinated, and we will try to secure hospital beds the best we can, which I believe is important. And Dr. Umi, do you have anything to add on the sixth wave and how we're going to protect ourselves or counter that? The sixth wave, I would say, how could we protect ourselves from or take countermeasures for? We will have to examine why we see a surge in cases and why it dropped rapidly. We need to study the factors that I believe are multiple closer. As a whole, we had the mid-August vacations, as well as summer vacation came all together, which led to a surge or spike in cases. And this is, in fact, now disappearing, or these factors are diminishing. And second, as we do not have sufficient data yet to back this, I think there are about 5 factors that help to diminish the number of cases. But how much of that has contributed yet is to be studied and analyzed in quantified terms. And the 5 factors, the first 2 are the effort of the people, which is the cooperation from citizens. We had a sharp spike in cases, which resulted into a serious constraint on hospital resources through the mass media has been reported to the public, and it has raised the sense of crisis amongst citizens. And therefore, cooperation was bolstered ever than before for preventing preventions. And second is especially traffic, especially at the nighttime, has reduced, especially foot traffic at downtown districts. In fact, we have asked to reduce this by 50% on the 12th of August, though we fell short of that 50% reduction for the last 6 weeks. It has been within a range of 20 to 30% at the nighttime of the population that stays in those downtown districts during the nighttime has been kept to 20 to 30% at a low level. The hypothesis that we have that people who are still to be vaccinated, in fact, have been further reduced, especially which is for those who are spending their time out at night, which is the second factor. And the third is the vaccinations. It's possibly true that it was effective by looking at how the productivity rate has mentioned. Vaccinations as a possibility have contributed to reduced cases. And however, detailed analysis in the true sense is not only vaccination, but those who have naturally contracted the virus, we need to actually conduct antibody tests or evaluations going forward. And fourth is that we see, in fact, the number of cases reduced at hospitals or medical institutions. In fact, first it started from a rising number of cases in younger people, and that has been, the seniors have been actually contracting COVID from younger people. However, with the quasi-emergency declaration in place, it actually stopped the infections among generations, and also climate conditions, precipitation, as well as other weather conditions may have also contributed as well, which would be the last or the fifth. And we need to study continuously what contributed amongst the 5 factors.
Next, Toromi-san from Yomiuri Shimbun, please. Kuromi from Yomiuri newspaper. Tomorrow, there's going to be the LDP presidency election, and there's going to be the new leadership decided. So you're going to be leaving the office. So after this, what are you going to intend to do? During your tenure, you've been working very hard for this COVID-19 and digital agencies, and especially setting up the children agency. What do you intend to do after this? For myself, so since I became a congressman, I've been always thinking what I would like to do for the year. So I always had a target for the yearly basis. And when I was elected second or third time, I was working on the abduction issue, the Mangyonbon vessel. That vessel has been coming over to the Akita port for 15 times. And I was able to take part in Niigata to stop this vessel, and that vessel has been the hotspot of some crime. And after that, the legislative-led policy was made in order to stop the vessel. I myself, as a politician, I'm now focused on the younger generation, and so that was a sponsored bill by the Congress people. So now I would like to hand down over my policy over to the next generation, and also hand down the society to the younger generation. Therefore, I have been trying to establish the children's agency. And for the medications for the senior citizens, I have now drawn a path to make this happen. So I would like the next generation of the administration work on that issue. And for the people working at the NPO, we have been providing 6 billion yen for the first time for budgeting for the supplementary budget for the NPO. NPO has been working for the restaurants to serve the food meals to the children. Those areas or areas that the government cannot touch directly. Therefore, through the NPO, we were able to provide foods to the children. As a congressperson and as a politician, I've been working in such area. And I would like to also work in that area too.
So now we'll turn to reporters other from the two coordinating, managing news outlets. Please raise your hand. Osanai-san from NHK, please. I'm Osanai from NHK. A question to the Prime Minister. You have been a cabinet secretary and have supported the Prime Minister then for a long time. And what was the difference becoming Prime Minister from being a Cabinet Secretary? And what message would you have for your successor, the next Prime Minister? And what was a miscalculation that you may recall that led to, in fact, drawing out or dropping out from the LDP presidency election? The difference between Cabinet Secretary and PM is that whether you're the ultimate decision maker or not, I think it's a heavy responsibility that I've really felt becoming Prime Minister. As a Prime Minister, for instance, under emergency declaration, for instance, decide to issue the declaration, and if so, many people, their life would be turned upside down immediately. So that judgment rests on the judgment of the Prime Minister, if he needs to. And in any case, these critical decisions, of course, those people who have their own business may no longer be able to run their businesses. And thereby, as the last decision maker, and those who are not, in the case of the Cabinet Secretary, I think that's the most biggest difference. And politics, of course, it's the Prime Minister, I think, needs to make the final decision in politics. Thereby, the next successor, as his predecessor, most naturally, in exercising that final judgment authority, you need to maintain your health, and you need to meet various conditions to make that judgment.
So next, Ishikawa-san from Kanagawa newspaper, please. This is Ishikawa from Kanagawa newspaper. I would like to ask you a question. And you were apart from any factions, and you have been starting from the very base as a politician, and now you became a prime minister. And tomorrow there's going to be the opening of the voting of the presidency of the LDP. And thinking about the past year, you've been mentioning that in order to work for the government to become a prime minister, ordinary people can make an effort to become a leader. So after you're stepping off from the office, what are you going to be doing first? At the general election, as me, I was born in a very rural place in Akita and have been graduating the high school there, and I've been going twists and turns, and I had become a mayor of Yokohama. And after second election, I have been coming up as the politician for the nation. And in reality, I became a prime minister as a national congressperson. And anyway, Japan is a democratic country, therefore, that is possible in Japan, and I would like to continue on with my activities too. And rather than speaking about Yokohama City, but I was a mayoral city assembly of Yokohama. And what I have been experiencing at Yokohama, I wanted to reflect it to the national policy. Therefore, for the local people, the municipality level, any subtle issues, the trivial things, I think everything is known at the local area. Therefore, all the insights comes from those area. Therefore, the inspiration comes there. Therefore, politicians need to be looking at the small issues.
Now, Mrs. Nishimura from Radio France. I'm Nishimura from Radio France. And border measures is my question. Since a year and a half ago, many foreign students could not arrive in Japan and could not be approved to come to Japan. In order to prevent the case count rise, of course, everyone understands how important the border measures are, but during that period, a lot of celebrities as well as athletes have entered the country. Why have you prevented foreign students from entering Japan, and from when they would be allowed into Japan? For foreign students, new entries, basically it has been suspended for the time temporarily. However, in receiving those foreign students, we see universities as well as education and enhancing the level of education, as well as in order to receive more foreign students at universities, it's important. And in this sense, we are proactively going to study measures to ease restrictions and to receive more foreigners. And for foreign students, it will depend on the progress on vaccinations in Japan, as well as the infectious situations inside and outside of Japan. We'd like to proactively consider it.
Shinohara-san with TV Tokyo, please. Shinohara with TV Tokyo. And so it was a difficult time with COVID-19, and you were working as a prime minister in such difficulty. And you've been mentioning about the vaccination. You were mentioning about Ministry of Health, but not only that, you were asking help from the MIC too. And Ministry of Health, you've been always saying that the Health Ministry was so large, it was difficult to listen to and move that ministry. And so why responding to the COVID-19 as a chief cabinet secretary, and you've been attending the Ministry of Health for a long time, you probably know very much about this ministry. So what is your view on this ministry? So Ministry of Health, thinking about the organizations and about their duty, it has become so gigantic. And the work related to Ministry of Health is now increasing nowadays. So the workload of the ministry is increasing. And other than the ministries, there's ministries in responsible, and maybe we can have multiple ministries within the minister. Therefore, in the very last front, the organization itself could be reorganized, or divide that ministry. I think that is unavoidable. And I myself, thinking about the 1.5 years through my response with COVID-19, I think this is crucial regarding that ministry. Thank you.
Now, from Japan Times, Sugiyama-san. I'm Sugiyama from Japan Times, and I'd like to ask a question on the not running from the LDP presidency means that your cabinet will be short-lived, and overseas there are concerns, in fact, that Japan may go back into having one prime minister a year, and in fact it may lead to the credibility issue of whether Japan could be trusted or not. What is your answer to this. We need consistency as well as credibility, of course, is most important for diplomacy, most naturally, which I believe is most important. And to have prime ministers every year from a national interest viewpoint, of course, that is not desirable. Myself, as prime minister, in order to come up with answers to various issues, I believe or feel that a year is too short. But we have collaborated together in my recent visit to the United States, for instance, the Quad. The US, Japan, as well as Australia and India have made various decisions. However, this in itself was started from Prime Minister Abe, my predecessor, who had proposed this, and was the transition of the administration in the United States. And India has now been a member of Quad. And we had the first in-person meeting amongst the Quad most recently. As we belong to the same LDP, we actually share the same principles in diplomacy, and this diplomacy would not change in terms of the policy. Free and open Indo-Pacific, of course, amongst the Quad Summit was a direction that of course, has been declared, and in that sense, I don't expect any impact. However, if you extend beyond 1 year, of course, would serve the national interest most naturally.
Next, Okawa-san, freelancer, please. Okawa Kogyo, Okawa, a freelancer. So, Prime Minister, thank you very much for your hard work. And I have been visiting the vaccination at the people with some disabilities and their parents at the facilities. The parents are thinking that their children could be vaccinated for the boosters the third time for the medical service provider and the parents and the people with disabilities. Can they have a preferential treatment to have the booster or the vaccination earlier than other organizations? Because sometimes the patients within the infrastructure are too young to be vaccinated. They are not able to go and get the vaccination. And you had Olympics and Paralympic Games. And through this Olympic Paralympic Games, Prime Minister, you yourself have been mentioning that you're going to be supportive of people with disorder or any handicaps or physical disabilities. And for intellectual disabilities, there could be some problems, but you were mentioning that you would like to call such activities over to Yokohama and host such games at Yokohama. And there should be a strong background or a patron in order to support such activities. So do you have any ideas to support such activities? Regarding vaccination, for the facilities of the disabilities and those who are working for such facilities, the vaccinations for the workers, I have been going through some investigations. I made a survey because you have been questioning me the other day. And as a result, at the end of August, for those within the infrastructure, 90% of the facilities has gone through the first vaccination. 70% of the people have gone, 70% of the facility has been finished with the first shot for the medical service provider. So regarding the service provider there, 90% of the facility has been gone through the first shot and 80% has gone through their second shot. So compared with other, I think there was not such a difference. So at any rate, I would like to be considerate in order to make the response. And I think You were talking about an institution called BOTAS in Yokohama? Yes, this organization is coordinated with the Paralympic Games. Therefore, they would like to make an activity so that in the future they will also become part and engaged with the Paralympic Games. I don't know the details. Therefore, I would like to investigate further in order to answer to your question.
So from Nihon Keizai Shimbun, Shigeta-san, please. I'm Shigeta from Nippon Keizai Shimbun. Going forward, your political activities from here on, you have the Ganesha group. In fact, they are supporting Diet members in the LDP. And are you going to center your activity on this group to achieve your policy objectives? Or are you trying to come up with a different faction or a group that would support you? Going forward, how I'm going to pursue my activities from here. I haven't honestly have set them yet, but there are policies that I have pursued, and I'd like to achieve them, of course. Going forward, of course, I have various ties with various groups or Diet members. I will actually convene various study groups. In various ways, not faction groups, but study groups, in other words.
Kashima-san with Fuji TV, please. This is Kashima with Fuji TV. So thank you very much for your hard work, Prime Minister. So North Korea has been abducting Japanese citizens, and it is not resolved yet. Yoko Tasakie has saying that she is full of despair. So how are you going to be thinking about the feeling of the family? And for the candidates running for the presidency for the LDP, many of the leaders are mentioning that they would like to meet the leader of the North Korea. But after the administration of Mr. Koizumi, this has not been achieved. So what is the hindrance? What is the obstruction becoming in the way? So what is necessary to meet that leader? Since I became a congressperson, I've been working for the North Korean abduction issue. The Mangyongbong vessel, that's a vessel owned by North Korea, and within a year has been coming in and out of the port of Niigata and abducting Japanese people. And so we can never allow that vessel to come into the port of our country. Therefore, with the 6 members of the congressman, I was able to create a team and able to stop that vessel coming into the port. And with that, the abduction issue, the North Korean abduction issue, became the top priority for me. And it's my lifetime agenda. As a prime minister, I feel very sorry that I was not able to resolve the issue, but it is a fact that I have been working in various ways to resolve the issue through diplomacy and utilizing people's network. And utilizing connections. So now I would like to hand this down to the next successor. But it is difficult to say when and which timing and how the things are going to be turned out. But I would like to explain fully of the situation to my successor. For this person to keep on working on the issue.
Ito-san from Radio Nippon. Then, now. I'm Ito from Radio Nippon, and I'd like to appreciate all your work over the last year. And my question to Prime Minister is that one of the pillars of the anti-COVID countermeasures is to vaccinate people by 1 million doses per day. And at the end of June this year, you have already achieved 1 million doses per day. But in making this decision, what was your judgment? Where did the political judgment come from and decision come from. And Dr. Omi, the 1 million per day administered doses, in medical terms, so what is the achievement that this has brought, and what is your assessment of it? 1 million, the target that I came across with, is because vaccinations, of course, is the trump card, I would say, or the killer application that would prevent the cases or suppress the cases. And in fact, when I decided that we will first prioritize those above or at 65 or above, and when I counted backwards, in fact, if I'm going to complete this within the end of July, it would need to be administered 1 million or more. And I think, in fact, we had approximately 600,000 at that point. And if we could advance that, I believe that we could surpass 1 million. That was okay as a statement, but of course after that it was a true ordeal because I had to come up with how to realize all of that. The municipalities, of course, I understand the situation, and of course the Ministry of Internal Affairs and Communications knows well about the municipalities, so we need to have them in, as well as dentist associations, because we were shortage. They had a shortage of medical doctors. So any association that could become a vaccinator, I asked the Ministry of Health, Welfare and Labor to have them in and participate in the program. And also we have corporate doctors that I heard of, and I asked why not have them in then. So they were also called in to have all of this together. This started rolling, the vaccination, the rollout took off from here, and the Japanese trade is that they're all serious. And in fact, 1.1 million on average was June, and 1.5 million in July per day were the average administered doses. So since starting in June, in fact, it was the focus was more on the shortage of vaccines. It was true that to certain cities there was a shortage, but we had maintained the vaccinations throughout the period. And in that sense, not looking back but just looking forward is really what has led to the results. And I'd like to also appreciate sincerely the public as well. 80% have been vaccinated, or we believe 80% will be vaccinated ultimately. So including the rest of that 80% from October to early November, we hope that we will complete the second dose for those who wish to be vaccinated, which I believe will reach 80%. And medical assessment, I think there are two aspects to this. First, the vaccines this time around, the preventive effects are not necessarily 100%. However, they prevent, in fact, serious symptoms, and I think they are a factor in rapidly reduced cases right now. Although the protection does decline over time after vaccination, and also, the speed or the rate of vaccinations. In fact, we were late in starting. However, the rate of the vaccinations were far surpassing that overseas. And as countries overseas, if vaccinations reach a certain point, they saturate, as you know, or start to decline. As the chairman of the subcommittee, and personally, I think the peak, in fact, was slightly higher than countries elsewhere. And in that sense, I do hope that as many people as possible would be vaccinated if we wish to do so. Two more questions.
So with that, Hoshino-san from Asahi newspaper, please. This is Hoshino from Asahi Newspaper. So extraordinary diet session is my question. On July 16, on the Constitution 53, Article 53, the opposition party has been asking to open this extraordinary diet, but you have decided to open this extraordinary diet at October 4th. And according to the Constitution, when the request is made, it has to be opened within the 20 days. However, you did not convene that within the 20 days. So why is it that you were not able to convene this extraordinary diet early? And the experts say that this is against the Constitution. So how are you going to be answering to their point outs? Today's diet, people have been questioning me about this convocation of this extraordinary diet. This is going to be decided by the government. And within the very tight schedule, we have been making the adjustment to convene. Within this condition, October 4th was the date to make an approval of holding the extraordinary diet. And at the same time, regarding how to respond to COVID-19, we have been opening and having various activities during the diet was closed. Many countermeasures were taken, and we have been answering to the question of the opposition party too.
And I have heard that it's not unconstitutional. Ms. Egawa, the freelancer. I'm Shoko Egawa, freelancer. And it's gratifying that we've reached the stage that we can completely lift the declaration in place. And in that sense, I'd like to appreciate all the work you did so. But one concern is that you will see phased easing of eatery constraints and elsewhere, which I believe would be necessary to avoid a rebound. And all the more for that reason, you can actually, did you think about actually the quasi-intensive measures to be in place, or the quasi-intensive declarations to be put in place? And of course, to assure the businesses to keep on operating, in fact, is also a constitutional right to a private constitutional rights. And also, what is your idea of your constraints on businesses? And if this is going to take place, of course, you need a legal base for that. And in that case, I believe it would have been better if you had prepared that as legal base to be deliberated at the Diet after being submitted. I believe would have been better. And also, Dr. Omi, can you give your insights into whether it would be better to have the anti-COVID quasi-intensive declaration put in place? Of course, this decision has been made by collaborating with prefectures or municipalities. And in this context, whether we should actually go for a quasi-intensive declaration. In fact, as a result, I haven't been reported of any requests or that to be adopted as a method. And by listening to the municipalities, we have, on part of the government, made this decision. On the matter that you just mentioned, which I'm afraid the microphone did not pick up, but I think within the legal framework that is existing, I think you can take that measures, possibly. The quasi-measures, why not have them in place or replacing the emergency declaration? At this today, at this subcommittee, of course, some people, some members had mentioned that we should have a continuum there were one or two people that expressed amongst the members that we should better replace the emergency declaration with the quasi declaration. There were two backdrops to this, as you've suggested. The legal structure wise, one was mentioning that it might be better to have the quasi declaration replacing it. And without that, the second one was that it would be misleading, were the 2 points to summarize. And the first point, this was raised by a member. It might be true to a certain extent, but in Article 24, Subarticle 9 of the Special Measures Act, the prefecture actually head could take measures basically that would be similar or equivalent, which is the first thing. And the second is that if the quasi measures do not replace the emergency, in fact, the message would be misleading that we can actually lower our guard from tomorrow. That is absolutely what we should not be doing, that we need to avoid. And we have actually agreed on this as a consensus. The first is asking the public to keep their guard, basically to keep their measures in place to avoid COVID. And also, second, schools as well as organizations where vaccination rates are not necessarily high. Of course, on the premise that you should respect individual will, you should still try to raise vaccination rates, which are the two wishes that we have to the public. And the other one is the request to prefectures as a consensus, which is a very strong opinion, is that we will cautiously phase down or have phased easing, which is Article 24-9 that I mentioned. And also, we won't actually resort to legal tools alone, but we may to take more comprehensive anti-measures, which are vaccinations and tests, as well as the QR codes that are backed by science, as well as CO2 monitors, as well as applications to monitor health, as well as actually conduct survey of sewage water. So we need to have a combination of these in lifting the emergency declaration. For the time being until November, the prefectures have made efforts on these. But to the winter period, we actually need a more intensive effort on part of prefectures on these elements that could be combined to prevent the spread. And QR code, as well as, of course, most naturally, we should strengthen the medical system. That does not need to be mentioned, but also the very last important point as a consensus that anything could happen in the winter season. In November, again, we will have the holiday season setting in, and from the past experience, that exposes the public to the risk of contracting the virus. And if the medical system is left as it is, we will see another constraint on the medical system. When we see that coming, we need to take fast action. Of course, we took fast action, but in some cases, the action was slower. But we need to take immediate action, are the 5 points that we have developed as a consensus. And therefore, we didn't resort to the quasi-measures, but instead take more comprehensive measures instead in lifting the emergency declaration. I'm afraid this is the last press conference. Is there room for one more question? Those who have raised their hand, of course, you can send your questions by email, and we will send the answers back by email in writing. This concludes the press conference.